guys, Michelle here with Chairside Chat, sponsored by TePe Oral Healthcare, and I just wanted to bring you some tips on some very amazing products that I don't think get enough love. One of them is the Compact Tuft brush. Actually, so I just used this and recommended it for a patient. It's got 700 densely packed bristles, so they're really scrubby. So think about those patients that always get stain on their anterior teeth, especially on the linguals. They get those lower anteriors that get a ton of calculus and crowded lower anteriors for that matter. And if you've watched or listened to the podcast or met me and, oh, you know, I love my coffee and my wine and I'm not about to give that up. And this is why I don't have to bleach my teeth very often. So I'm gonna show you how I kind of recommend it for patients. So for those lower anteriors, I just have them scrub one tooth at a time and really kind of have them sit there with it in the chair, focus on that one tooth at a time. But it's also really great for occlusal surfaces, so for children, for parents that need to scrub those occlusal areas. And another thing is locator attachments. So for those dental implants, those overdenture implant cases, just imagine, got my little locator attachment here, these guys, where they snap on. How often do we get things caught in there? Seeds and debris, calculuses get stuck or builds up in there. So all you have to do is take this and kind of push it down in there and scrub out any of that debris, and then you can actually use it inside of the denture as well to scrub. It's such a good tool, and I'll actually show you how I use it on my anterior teeth. And again, I'm using this a few times a week. It's not every single day, but I pair it with a little baking soda. I wet the brush, put a little baking soda in a little container. You can even put it in your hand if you washed your nice little clean hands, and then you're gonna scrub it. And so if I get a little closer, you can see where it's gonna flex and fluff out, and I just buff one tooth at a time. Pretty easy, right? And then I do the linguals, because that's where my coffee stain is. Right here. Gets that stain right off. And I have a lingual retainer. I mean, who wants to clean around those things? They're horrible. They're horrible for the patient. They're horrible for the clinician. But I also don't want my teeth to move. So I scrub. It's almost like talking with your mouth full of food. That's just gross. But I scrub each individual tooth and around the actual retainer itself. And you can even do these lower anteriors just to get that stain off of the teeth. So give that a try. You can find that at tepeusa.com. It's called a Compact Tuft brush, and it's 700 densely packed bristles. So it's gonna really get that debris and that real sticky bacteria and stain off of the tooth surface. So go check them out. Make sure you can find them on Amazon as well. So tell your patients about them, give them some so they can try it out at home, and good luck with that.